minute.
Well, a simple device has just been approved by the FDA, and it could be what the doctor ordered for 40 million Americans who suffer from migraine, tension headaches, all kinds of headaches. It's called an NTI.
Migraines are one of those medical conditions that can literally ruin your quality of life, but a quick trip to the dentist could change everything.
Well, the pain of chronic headaches can literally stop you in your tracks, and sufferers are often willing to try almost anything just to make that pain go away.
You've had them before. You
yeah.
know, it's agony. But what if we told you you don't need drugs, you don't need needles?
San Diego dentist James Boyd knows what it's like to suffer.
I was a guy who had a headache every day, all day long for 12 years in a row.
The pain led him on a quest to find a solution to his problem.
I tried the dental mouthpieces, and that didn't seem to help me. I kind of got a little bit worse. So to me, that was a diagnostic event. If you can alter your condition and make it worse, figure out how you got worse and back out of it.
For the last decade, he's been developing a device to prevent migraines. His key discovery: night clenching was allowing his headaches to be triggered more easily. His solution was a small mouthpiece called an NTI that snaps onto the two front teeth. This is what the device looks like originally, sort of hard and boxy looking. But by the time it's custom fit just for you, it's ground down in shape and looks something like this.
Traditional dental mouthpieces give your back teeth something to squeeze on, where an NTI device only gives you that one-point contact, so the intensity of your clenching is reduced to about a third of what you can do otherwise.
Tanya Goodman first tried the NTI 2 years ago when she was having horrible daily headaches.
Just dull, ongoing, forever, all day long headache. And it wasn't like the kind of headache, it wasn't like an ice cream headache. It was more where it was here. It was back here, like I constantly felt myself massaging in the back, and then up through the sides as well.
She felt results right away.
The first night I wore it, I woke up in the morning and just went, wow. I mean, wow. How many people can say, wow, I rocked last night. I slept awesome. That wasn't, I mean, it was awesome.
I was so inspired, I wanted to know if an NTI device would help me with the headaches I experience.
Treating the patients is the thrill of it, because I feel like I'm talking to an old version of myself. So I know what to ask them, because I'm looking for, I call it the headache animal. It's in there trying to hide from me.
Truly, Dr. Boyd seemed to know just what I was feeling.
How many mornings a week do you wake up with a 0, you feel fabulous?
Well, I never say I feel fabulous. There's always something there every morning I wake up.
I never say, do you wake up with a headache? Because everyone asks them that. They say, no. I say, when you wake up, do you feel fabulous? And they usually, well, as soon as they hesitate, I know I'm probably on the right track.
For Tanya, the NTI worked better than anything she had ever tried.
It's really strange in a dental office to have someone come in unannounced and say, you guys just changed my life. A dentist doesn't get to do that.
Now, it's been 2 weeks since I got the NTI device, and I've been wearing it every night while I've been sleeping. It's completely cut out my headaches, and I'm not clenching my jaw. A lot of people also have that problem. I'm one of them.
When most of us get a headache, we head straight for the medicine cabinet. But what if I told you that this teeny tiny little device could help you get rid of your migraine pain for good? Some say they doubted a dental device would do the trick, but now they say they couldn't live without it.
Where I couldn't hold my head up.
I was just so dizzy. I have neck problems.
It affected my daily life.
More than 28 million Americans suffer from migraine headaches. Jenny Beats is one of them.
Stress.
Jenny's headaches were usually brought on by stress and anxiety. Her doctor prescribed several different drugs to treat her.
I wanted something to help me, and I felt like in the beginning it was helping me.
But the migraines returned, and it started to impact her job.
No pills or anything would take it away, and I left work a few times because of it.
Please want to come on back with me? Yvonne Paradise's pain was so bad she could barely open her mouth. Functioning normally, she says, was a luxury.
I was just so dizzy. I mean, I'd have to sit down and close my eyes and wait for it to pass. It was just awful.
Well, any questions or?
Yvonne didn't turn to her doctor, but to her dentist for help. So, Dr. Campbell gave Yvonne an NTI TSS dental device to try.
It decreases your ability to contract your muscles forcefully, and by virtue of that, by not being able to clench, you can kind of break the headache or the migraine cycle.
The device is FDA approved, and studies show it works.
82% of people that had migraines and tension headaches had a 77% decrease in the incidence and the intensity of those headaches.
Yvonne's a believer.
There's a big difference.
Even skeptics like Candace Mortensen says the device makes a big difference.
Tried for a while, like not wearing it to see if I could notice, and I would wake up a lot in the night, and I could just feel, you know, that I was closing really hard.
But perhaps the best news for migraine sufferers is that no drugs are needed to get rid of the pain.
I do not have headaches anymore at all. I get up, I go, I'm ready for work, I'm, you know, in a good mood and ready to go.
All right, here's another close look at it. The NTI TSS device is FDA approved, and it is covered by some insurance companies. For more information about the device and who prescribes it here in Utah, you can go to our website at KUTV.com. If you get headaches, this might be the ticket.
It's amazing. It does all that.
And people that get them, I'm sure they would try it because
Oh, yeah.
the alternative is pain and suffering. All right, Shauna, thanks.